I'm going to ask Lauren to hop on screen and ask her this very important question, which you are a seasoned women's health advocate in your personal life, and you've been going to the Hill as well. But I want you to talk a little bit about how you define advocacy.
Hi, everybody. Thank you, Katie, for letting me be here today. I think that advocacy can be defined in many different ways. Everybody may have their own definition. And as you said, you know, many people believe that advocacy is just speaking to Congress. But I believe that advocacy starts with self advocacy, understanding your own value, educating yourself in when you're speaking about healthcare specifically, is educating yourself within your own health or the health of others that you are trying to advocate for, and being willingly to question your care so you can take an active role in your own health. I think that that is so important. And then from there, it's about taking that lived experience to shape the system's influence policy and use your voice to tell your story so that others don't have to navigate their health alone and they can come to you for advice. If you can tell your story, and you could help others want to tell their story, and you could help others become educated. And I think that that's a role that others don't really speak about when we talk about advocacy, is really understanding your value and really talking to your doctors and taking an avid role in your own health, and then taking that, creating your story so that you can help others.
That's amazing. Thank you for that. We so appreciate it. And I think you're totally right when you think about that lived experience and framing it from a perspective of everything that you're doing, especially when it comes to your health and well-being, is
Yeah.
advocacy, right? I
Mhm.
mean, and I think once we all understand that, I think we can all feel much more empowered in our care and our well-being moving
Yeah.
forward. So
You know,
thank you so much for
I,
that.
oh, you're very welcome. And just one thing, I live with a rare disease, as you discussed before. And so I almost had to get my MD in my own disease. And I think that when you live with a rare disease, or if you live with a disease that many healthcare professionals are unaware of, or even something like fibroids that can take many doctor's appointments to even diagnose, you need to almost be ahead of the doctor to, in some level, diagnose yourself, or to really have them understand what you're going through as you get that appointment, as you're going through and ask them the hard questions.